Committee Chair Rodgers for 5 minutes for her opening statement.
Good morning. I'm glad we're here today moving so many important pieces of legislation that will strengthen the health and well-being of the American people, almost all of which have broad bipartisan support. This committee continues to prioritize examining programs set to expire, making changes if necessary, and reauthorizing those programs in advance of their expiration. Many of the bills before us today reauthorize important programs that are due to expire September 30th, and I'm hopeful we can renew them in advance of that deadline through regular order. This committee has a rich history of plowing the hard ground necessary to legislate, including our bipartisan work to ensure we are moving forward timely reauthorizations, as well as new efforts like the Lower Cost, More Transparency Act. I look forward to seeing all of these important initiatives be signed into law. I'm especially excited that we're considering my legislation to authorize the Include project at the National Institutes of Health, which signals to appropriators that it should continue and receive robust support. My mission of improving the lives of individuals with disabilities is no secret, and is deeply personal. At the time Include was established, Down syndrome was among the least studied and funded genetic conditions at NIH, despite it being one of the most common chromosome abnormalities. And now Include has funded over 200 awards and helps coordinate Down syndrome research and resources across 20 NIH institutes and centers. One of the most incredible things about the Include project is its potential, not just to benefit those individuals with Down syndrome, but for all patients that suffer from cancer, Alzheimer's, and many other conditions that occur often in those with Down syndrome. I'm proud of the work of this bill and the Include project and what it has already accomplished. And I ask for your support in helping everyone with Down syndrome and their families and many more live lives to their fullest potential. My legislation, as drafted, increases the authorized level over what is currently appropriated. I will continue to explore all options to ensure we're authorizing this program in a fiscally responsible manner. That said, I'd like to move forward today with a voice vote as we continue to work on how best to address the important funding for this program. Additionally, we'll be considering Rep. Harshberger's bipartisan Seniors Access to Critical Medications Act, which has been co-sponsored by a number of members from both sides of the aisle on this committee. I know that there's more work to be done regarding technical assistance and offsetting any cost associated with the bill, but I'm hopeful that we'll be able to resolve those issues before consideration by the full committee. We're also considering Rep. Carter's bipartisan Kidney Patient Act. As we discuss this bill, I would note that Congress has delayed putting these drugs into the ESRD bundle in previous laws with bipartisan support. And just last week, a version of this policy passed out of Ways and Means Committee with only one no vote. I hope my colleagues support the bill today, and if necessary, we can continue working on technical issues before the full committee markup. I won't take the time to discuss in detail all of the other important bills before the subcommittee today on issues such as Alzheimer's, heart disease research, emergency care, but this markup is an example of how this committee continues to lead the way in showing how to get work done for the American people. I'm proud of what we continue to accomplish when we work together, and I look forward to furthering this important work with all of you. I yield back.
Thank you.